Hey everyone, this is State Senator Carlos Guillermo Smith. Thank you so much for inviting me to be a part of this really important Medicare for All conference in Rockledge. I am so sorry that I can't be with you in person today, but I'm just really grateful to join you by video and to stand in solidarity with you all who are fighting for a fair, a humane healthcare system in Florida that is so needed. We all know Floridians are living through an affordability crisis, and people are getting hit from every angle, from rising housing costs, property insurance spikes, the cost of groceries and utilities. But nowhere is that crisis more personal and more painful than in healthcare. Everywhere I go, I hear the same stories. People are skipping doctor visits because the copay is too high. Parents are cutting pills in half to stretch their prescriptions. Seniors are trying to make one vial of insulin last longer than it safely should because they simply can't afford the next refill. One unexpected illness or emergency room visit for so many families can actually push the entire family into medical debt that takes years to climb out of if they ever do. And that's just not acceptable. It's not acceptable in the richest country in the world and not acceptable in the state of Florida. That's why I filed Senate Bill 222, which directly targets one of the most urgent and critical aspects of this crisis, the cost of diabetes care. Senate Bill 222 puts a hard cap on out of pocket costs for diabetes management under this bill. A health insurance policy in Florida, private health insurance, cannot charge more than $35 for a 30-day supply of insulin, regardless of the quantity or the type of insulin that is prescribed. It also caps the cost sharing for diabetes devices and diabetic ketoacidosis prevention devices at no more than $100 for a 30-day supply. That means insulin, test strips, continuous glucose monitors, syringes, etc. Basically, the basic tools that people need to stay alive cannot be priced out of reach through sky high copays and coinsurance. This is about making sure that people with diabetes aren't punished financially just for needing the medicine and devices that keep them healthy and out of the hospital. No Floridian should have to choose between their insulin and their rent. No parent should have to decide whether to pay for their child's diabetes supplies or put gas in the car to go to work. SB 222 is about immediate relief for people, and it's about relief right now when they need it. But we also know that the problem goes beyond insulin. The entire healthcare system is tilted against patients. It's fragmented, confusing, and driven too often by profits over people. That's why I also introduced Senate Bill 348. 348 creates the Task Force on Universal Healthcare in Florida and directs it to design the Healthcare for All Florida plan, which would be a universal publicly funded system that covers every person in our state. This task force will bring together patients, providers, labor experts, and community voices to map out how Florida really can move to a single payer Medicare for all system that is equitable, affordable, and comprehensive. SB 348 is about doing the homework and building the blueprint for this. How do we ensure everyone has coverage? How do we remove cost barriers to care? How do we protect people from medical debt and financial ruin when they get sick? And how do we make sure that our healthcare dollars go towards healthcare, not to bureaucracy and corporate overhead and executive salaries? Taken together, these two bills, SB 222 and 348, are part of the same vision. SB 222 offers immediate concrete relief on the cost of diabetes care, and SB 348 helps us plan and build the long-term transformation that we need, a universal system where healthcare is a right, not a privilege. But here's the reality. I can file these bills, as Medicare for All Florida has encouraged me to do, but I can't pass them alone. That's where you all come in. Every single person that's here at this conference that is watching this, you have power, you have a voice. And in this moment, we need you to use it. I'm asking you to contact your state senator and your state reps. Tell them that you support SB 222 because no one should be priced out of insulin or the supplies they need to manage their diabetes. Tell them that you support SB 348 because Florida needs a real plan to move towards universal Medicare for all style coverage. And tell them that you want not just for them to consider these proposals. Tell them that you want them to co sponsor them and fight for them. Call their offices, send emails, show up at town halls and delegation meetings. And if you're an organization, pass a resolution of support for these bills. Make it clear that doing nothing is not acceptable, that tinkering around the edges while people are rationing insulin and drowning in medical debt is just not enough. We know that this kind of change is possible. It's possible because we've done it before. Medicare didn't just appear out of nowhere. Medicaid didn't just appear out of nowhere. It took organizing, it took movements, it took regular people demanding that their government do better. That's the same energy we need today for insulin affordability, for universal coverage, for Medicare for all in Florida and across the country. I filed these bills because I believe in a Florida where people can actually go to the doctor when they get sick, get the medicine they need, and not worry that a single prescription or hospital visit will wreck their finances and draw them or push them into bankruptcy. It's a Florida where our healthcare dollars actually go towards helping keep people healthy, not boosting corporate profits. It's a Florida where your income, your zip code, and your pre-existing conditions, they don't determine whether you get care. That's the future I know you're fighting for at this conference. And I want you to know I'm right there with you, alongside you in that fight. So thank you for the work that you're doing across Florida, the educating, the organizing, and pushing for a healthcare system that truly serves the people. And a special thanks to Healthcare Now and Medicare for All Florida for sponsoring this event. Please keep raising your voices. Please keep building pressure and organizing. And please reach out to your lawmakers and tell them to co-sponsor SB 222 and SB 348. I know that together we can make sure that in Florida, no one has to choose between their health and their financial survival. And we can move closer to a true Medicare for all future. Thanks, y'all. Have a good one.